Hello everyone, this is mbbs gallery and today our important topic is about the phenytoin, and let us see introduction, pharmacological action, mechanism of action, pharmacokinetics, adverse effect and drug interactions one by one. Introduction. It is also called diphenylhydantoin, so it will come under the group hydantoin of the anti-epileptic drugs, and it was synthesized as analog of barbiturates. So it is not a global CNS depressant, but it has a mild sedative activity. The most prominent action is abolition of clonic phase of maximal electroshock seizure with no effect on prolongation of clonic phase. So we have already known the tonic-clonic phase. This phenytoin has a prominent action on abolition of tonic phase but no action on clonic phase. Pharmacological actions. It has a good anti-seizure activity. It is one of the most effective drug against generalized tonic-clonic seizure and partial seizure. So it has a good anti-seizure activity. It is one of the most effective drug against generalized tonic-clonic seizure and partial seizure. It brings about its effect without causing general depression of the central nervous system. As we already seen in introductions, the phenytoin is not a global CNS depressant. See about the mechanism of action of phenytoins. The phenytoin acts as an antileptic in three ways. First one, delays the recovery of sodium channel from inactivations. Second one, by blocking the sodium channel in inactivated state. And third one, by blocking high frequency firings. The blocking of sodium channel in inactivated state stabilizes the neuronal membranes. That in turn inhibits the generation of either inhibits generation of action potential or inhibits the spread of seizures. So finally, these four ways again lead to an anti-epileptic activity of the phenytoins. By these mechanisms, the phenytoin controls the epilepsy. Pharmacokinetics. The phenytoin is poorly water-soluble compound and hence absorption is low, but is almost completely absorbed on oral administrations. Phenytoin should not be given intramuscularly due to unpredictable absorptions. So what about the plasma binding proteins? So it has a 90% of plasma protein binding capacity. Then moving on to metabolization. So initially the phenytoin compounds are metabolized in the liver by the first order kinetics, and as the doses increases, it is metabolized by zero order kinetics. And so one of the most important points here is it is an enzyme inducer. Let us see about the adverse effect of phenytoins. Let us remember the adverse effect by EC mnemonic, that is H. The letter starts with H. The most commonest adverse effect is gum hypertrophy. Here, this is common in younger patients. This is actually due to overgrowth of gingival collagen fibers. So it can be minimized by maintaining the oral hygiene. And another most important symptom is hirsutism. It occurs and acne skin worsens. Then hypersensitivity reactions including rashes, DLE, and lymphadenopathies can occur. And fetal hydantoin symptoms. It is one of the most important thing in phenytoin, because in the pregnancy mothers, on taking phenytoin during her pregnancy, it can induce a most important teratogenic effect called fetal hydantoin symptoms. That means fetal will develop with microcephaly, hypoplastic phalanges, and cleft palate. Hypoplastic phalanges and underdeveloped phalanges and limbs, and cleft palates, microcephalies, and hallucinations and hyperglycemic conditions. And another commonest adverse effects are ataxia, diplopia, nystagmus, nausea, vomiting, epigastric pains, and on IV injections, the local site where the injection is injected, it leads to an injury, and that produces intimal damage and thrombosis of the vein. Then the edema will occur and discoloration of the injected limb will appear. And that is another symptom, another adverse effects of fallen BP and arrhythmias can occur. So that there is a need of continuous monitorations and ECGs. Then megaloblastic anemia and osteomalacia. So the phenytoin actually interferes with the folate. It interferes with the folate metabolism promote metabolism, and so it causes microblastic anemias, and it interferes with the vitamin D activation, so it produces osteomalacia. About the uses of phenytoins. Phenytoin is especially used in case of generalized tonic-clonic seizure and focal onset seizures, but it is not useful in the absence seizures. So the absence seizures particularly in can be controlled by another drug called, it is also an anti-epileptic drug, it is called ethosuximide. We are all come across with ethosuximides, and IV infusion of phenytoin will control status epilepticus. And another is, in place of carbamazepines, we can use phenytoin in trigeminal neuralgia, and also useful in digitalis induced arrhythmias. So we can use phenytoin as a cardiac arrhythmias cases. Next topic is drug interactions. So the phenytoin is an enzyme inducer. If suppose the phenytoin is provided with the phenobarbital, they both can increase each other's metabolisms. In fact, the phenobarbital inhibits the metabolism of phenytoins and results in toxicity. Then another drug, carbamazepines and phenytoins in combinations, enhances each other's metabolisms. Then valproate. Valproate displaces the protein-bound phenytoin, that is due to affinity towards proteins. The valproate displaces the phenytoins and results in phenytoin toxicities. Cimetidine and chloramphenicals. These both drugs inhibits phenytoin's metabolism, results in toxicity again. And antacid. Antacid is also decreases the absorption of phenytoins. And this is all about phenytoins. I hope this will help you to remember all those things, and I think I made easy about phenytoins. Thank you. Support us.